When my husband Guido and I retired in 2003, he after 23 years with the U.S. Foreign Service and I from managing health projects in Latin America, we were looking for something meaningful to do with our retirement years. We decided to return to Peru, where he was born and where I served in the Peace Corps in the early 60s, to open a health clinic for the underserved indigenous population. Although very beautiful, the cold climate in the Andes is very harsh for those without heat or potable water. With extensive help from Northwest medical teams and their volunteers, we decided to open a health clinic in a small town near Cusco in the Valley of the Incas named Coya. With the solid support and total commitment of the community, the local government offered us a facility which had previously served as a jailhouse for stray animals. Virtually all surrounding villages donated labor and construction materials for the clinic. Northwest Medical Team's first volunteer construction team arrived to assist us with construction in 2004. The clinic opened in May of 2005 and is now hosting between 12 to 15 visiting U.S. medical teams per year. Patients come from all over Peru with the hope of being seen and treated by an American doctor and nurses. To date, 33 visiting U.S. medical teams and our national staff have examined and treated more than 20,000 patients and successfully performed close to 700 surgeries at the clinic. Patients include children and adults with dental, ENT, gynecology, plastic surgery, orthopedic, optometry, and ophthalmology-related problems, as well as every other imaginable type of health problem. One recent patient is Olger, who at 4 years of age could not walk due to his club feet. Following surgery at the clinic, he is now on his way to walking like a normal 4-year-old child. Clinic staff has increased from 2 nurses and 1 general practitioner when we opened in 2005 to 15. We now have 2 operating rooms, 4 consultation and 3 recovery rooms, a dental unit, complete lab, X-ray unit, a pharmacy, the first and only one in Coya, electrocardiogram equipment, a gynecology unit, general medicine, and ultrasound equipment. Mental health has also recently been added to the clinic services, all of which are provided 7 days a week. American school children support the clinic and learn about Peru by collecting toys for young patients, and women's groups make and send soft, warm blankets for young surgical patients. In addition to Northwest Medical Teams, now Medical Teams International, the clinic has partnered with Qualcomm, which has donated computers, communication equipment, information management personnel, and provided connectivity between remote communities, the clinic, and consulting physicians in the United States. Additional partners include the FACES Foundation, One Child at a Time, Capital City Medical Teams, and Bosch International. 5 Bosch volunteer optometrists and Service to Humanity teams have provided glasses and eye exams to 4,700 patients. Both our visiting and Peruvian medical staff repeatedly see terminal patients and concur that with a capability for early detection, the lives of many of these patients could most likely be saved. Acquiring a CT scanner will result in early detection and provide the diagnostic capabilities not found anywhere else in the Sacred Valley. It will also provide income generation for the clinic, allowing us to treat even more patients. There's also a great need for a prosthetic workshop to care for more than 20,000 identified amputee cases in the area. The clinic seeks support to be able to provide both of these very much needed services.
Tristes melodias.